Here are Which twin would you save? Mary and Jody are conjoined twins joined at the abdomen. Mary was the stronger sibling and was saving the life of Jody. Jody was only surviving because she was stealing blood from Mary through a shared artery. But Jody was sick and dying. If she was left attached to Mary without any surgery, as soon as Jody died, Mary would soon follow. If they were surgically separated, Jody would die immediately and Mary could have a chance at a normal life. Her parents don't want either child to pass away and do not want an operation. This will mean certain death for both these twins in 6 months. What do you do? A. Leave them both joined and they both die in 6 months? Or B. Plan surgery to separate the twins. Jody doesn't make it through, but Mary survives. Or C. Wait until Jody passes away naturally and then perform emergency surgery to separate Mary. But this last choice only leaves Mary with a 60% chance of surviving. Comment what you would do and why and my answer in 24 hours. If you saw this tattoo on a patient having a cardiac arrest with no other details, what would you do? This case actually happened at a Florida hospital and what the doctors did will shock you. At first, the doctors were going to do CPR and not honor the tattoo because there was no way to know what the man actually wanted. Tattoos are not legally binding and are a bit too ambiguous to act upon. And typically you need an official do not resuscitate form. Anyway, in this case, the doctors called up the hospital's ethics consultant and he said they should honor the tattoo. And luckily for the team, they also managed to find a copy of his do not resuscitate form. Ultimately, the man did die, but the tattoo raised all sorts of medical and legal dilemmas. Comment if you thought they did the right thing. If you saw this tattoo, you're a surgeon working in a busy hospital. A 20-year-old man arrives after being stabbed in the abdomen. The blade has gone through his abdominal aorta and he needs emergency life-saving surgery now. You're about to consent the patient for the operation, but he swears at you and demands a white surgeon does the operation, not you. But you're the only surgeon in the hospital who can do this procedure. The only other white surgeon has just started training, he can't do it. And the next closest hospital is 4 hours away, he won't survive the journey. What do you do? Do you A. Ignore the patient's wishes, put him under an anesthetic, do the operation to save his life? Or B. Accept the patient's wishes, keep him comfortable and let him pass away? Or C. Make the patient believe the junior surgeon who's white will be doing the procedure and once the patient is asleep, do it yourself and save his life? Comment your answer and why. You need to choose one life to save. You're the lead doctor in a busy intensive care unit. You only have one ventilator left. Suddenly, 3 sick patients affected with coronavirus are brought to the hospital. They all need a ventilator to have a chance at survival. Who do you give the ventilator to? Do you choose A, the 12-year-old boy with diabetes? Or B, the 67-year-old doctor who got coronavirus in the line of duty and as it happens is the lead researcher for a new COVID-19 vaccine? Or C, the 25-year-old mother of 3? Comment who you would give the ventilator to and what. You need to never crack your neck. Here's why.